Namaste. My name is Dr. Chetali Samant and I am a consultant in the Pediatrics Department of Ramaiah Ayurveda Hospital. Polluted cities, smoke everywhere, air pollutants, whether it is outside or within a house, has created this large issue of chronic respiratory disorders such as childhood asthma in our children. Changes in the environment, the rapidly changing environment is also increasing these issues. WHO says that our children are more susceptible to chronic respiratory conditions because their lungs are young, they are just developing, their immune system is not strong enough to fight off these pollutants, and hence they suffer from chronic issues such as childhood asthma. Childhood asthma is not just a respiratory disorder. It is a condition which affects the entire lifestyle of the child, causes school absenteeism, doesn't allow them to eat certain foods because it triggers asthma, doesn't allow them to enjoy activities which other children enjoy, such as running or climbing or water sports activities, which can affect their quality of life. While most conventional medicines, be it inhalers, steroid-based medicines, nebulizers, help to control the chronic attacks or constant attacks of asthma, it doesn't provide a permanent solution to this issue. One of the most common questions which parents ask us as Ayurveda consultant is, can Ayurveda help my child get rid of childhood asthma? The answer is yes. Good, well-planned Ayurveda treatment can over a period of time help children successfully be asthma-free and lead a normal life. Because Ayurveda does not suppress the symptoms or put a band-aid over symptoms and manage them for time being. As long as we just prevent the attacks, we are fine. We don't take that kind of approach. Ayurveda takes an approach which focuses on the root causes of childhood asthma, those being chronic inflammation in the airways or in the lungs, inflammatory foci elsewhere in the body, for example, imbalanced gut health, for example, changes in the body which make their immune system more jumpy or more sensitive to common triggers which can be there in the environments, be it dust mites or dust or smoke or any kind of allergens. Ayurveda starts focusing on why the body is so sensitive to these kind of allergens. Ayurveda focuses on why their immune system can't fight off these, why does it lead to asthma, whereas in other children it may not be affecting. This unique approach of Ayurveda is what helps it to help children with chronic childhood asthma. Time-tested, thousands of years old Ayurveda medicines and remedies are very safe for use in children, which is also another question which parents ask us. Yes, you may be having very effective remedies, but are they safe to give in children? We have heard that Ayurveda medicines contains metals and heavy metals, they are bad for liver, bad for kidney. No. Over-the-counter Ayurveda medicines which do not carry any manufacturing label or any information about the medicine should never be given to children. But here at Ramaiah Ayurveda Hospital, we ensure highest quality medicines which are very safe for children, especially in childhood asthma. Ayurveda medications focus on three different things when we treat childhood asthma. 1. Helping digestion and gut health. 2. Strengthening immune system. And 3. Symptomatic management. That is, how can we prevent constant wheezing attacks in children? How can we bring down constant wheezing, breathing difficulties, chronic cough, etc. in children? How can we strengthen their immune system and how can we help their gut health? This three-pronged approach helps us give a comprehensive solution to childhood asthma. Do understand that these are not medicines which can be given for 1 or 2 days and will give long-lasting permanence of results. No. Sometimes we need to give medicines in spurts. That is, we complete a course, give a couple of months gap, we again start them. We focus around change of seasons. We focus around seasons of the year when our immunity can be strengthened. Because Ayurveda recommends certain medicines, like many of people must have heard of Chyawanprash, which is commonly given to boost respiratory immunity in children. So there are specific ways of giving these medicines and specific seasons of the year when these medicines work their best. So we help to plan the treatment in such a way that maximum benefit can be drawn out of the treatment plan. Ayurveda also focuses a lot on diet. Eating any kind of food and expecting our body to heal, it's something which even we need not be rocket scientists to understand that, right? certain foods have certain effect on the body, and same applies to childhood asthma. There are certain foods can make the inflammation in our body more severe, causing more attacks. And there are also certain foods which can affect our immune system and make it more weak, which will also make childhood asthma more chronic and more severe. So Ayurveda focuses a lot on modifying diet of the child in a way so that the body gets support in its journey towards healing. This is an entirely natural process against a process which involves just giving of medicines to suppress the system and suppress symptoms, which only come back with 3 times the force when we stop those kind of medicines. So Ayurveda medicines focus on sustained and permanent results which help the child to be asthma free. So if your child suffers from childhood asthma, do seek help at Ramaiah Ayurveda Hospital to help your child lead an asthma free life. Thank you.